priority to this service. Thank you very much.
Thank you. Naia.
Naam. Kwa kuanza na disability inclusion kwa CHW, bado miongozo inaendelea kupitiwa, kuboreshwa, na ni wiki mbili tu zilizopita kulikuwa na kikao kwa ajili ya uboreshaji wa disability, imekuwa included pale. Nikienda kwenye NAIA, pamoja na nguzo zake 6 ya shule na nje ya shule, na kulikuwa na swali lingine kuhusiana na huduma huduma shuleni na Wizara ya Afya. Kwa hiyo bado kuna muingiliano kidogo, lakini kadri muda unavyoendelea vikao vina.
Okay, sawa. With that, I will invite Dr. Petro, who has been working on out of school. Tumeongelea ndani ya shule na nje ya shule. So Dr. Petro, please come forward and talk a bit about out of school ASRH
for the discussion. Much of the things that I would have said tayari vimesemwa through the panelists but also the contributors. But I'm just want to give some field experience from the last mile in Mahenge, Ulanga, what we are going through, especially for the out of school youth. So challenges, mainly they are rooted from the design of these interventions that we do. And some of the challenges that we have these interventions, but they don't consider where we really get this youth who are out of schools. That is one. But two, they live in the community. So we have some barriers from the community, from the misconceptions. What we have been doing, one is to have the plan that includes the adolescents themselves. And our project, the AHA, is named Adolescent Health in Adolescent Hands, reflecting the need for adolescents to be included, not just in the implementation, but from the design of these interventions. But also we broaden the scope of the implementation of these interventions by including the adolescents, but also now the other groups in the society. For instance, the caregivers, the parents, but also working in collaboration with other stakeholders. And this is so much rooted from what is advocated from the NAIA, which is our guideline in implementation of this. So thank you so much. It was brief, but thank you for sharing the experience.
If we have a question, we'll come back to you, Dr. Petro, for the out of school. There was a question regarding media, Dr. Krisha.
Thank you, moderator. So I will answer both questions. The first question was about how do we reach the last mile populations where the use of social media is less. Actually, in Tanzania, the biggest media that is used is radios. We're still using radios. So far, I can say that the two sides complement each other. I'll give the real example of how we work with SolidaMed. So when we went to the primary healthcare project in Malini, we had all the tools, including those provided by the Ministry of Health. So they provide you with all those vipeperushi and the like. And that is media, traditional media. And CHWs provide to the community before we go for outreach, to let them know kwamba we'll be going for outreach. But even during outreach, that chance when you're coming for ANC during outreach, you get information about monkeypox, you get information about COVID, you get all the information there. But also another way that we use is the local radios. So SolidaMed also, staff members provide information on what they do using the local radios. I mean, in last mile populations, they don't usually use much of the popular radios. They rely on the local radios. So we use that too. But why do we still say that there is an importance of showcasing what we're doing on the social media that is on the urban side? So when I got the chance to work with SolidaMed in April, I shared my excitement. And Dawa Mkononi, if you've heard of them, they reached out to me. They told me that they're excited to also partner with SolidaMed so that they can provide the delivery kits for all the women that we see during our outreach in Malini. So they provided those kits, And the special thing about these kits is that they provide vaccine information in the delivery kit, that you are sent a message. The moment you get the code in the delivery kit, you send a message, and then you are always reminded on when next to give your child, to take your child to the facility for vaccination. So we use all these ways to complement each other and build partnership, build collaborations that improve healthcare access to the last mile populations. Another question was about, we are seeing that we have misinformation from the media, especially from people who are not medically trained. So that is a huge issue. I remember there was an ilitokea TACAIDS walitoa information on the increase of HIV infection among adolescents, and instead of saying 0.013%, the media quoted as 13% increase. And it was a huge issue, and we tried to like contain it from back. We can't have 13% of increase in HIV. The world will be looking at us like, what's happening? So the big issue we are doing right now is encouraging medically trained personnel to go to the media to provide information, but also including journalists who are not medically trained to understand the things which are health related, so that they can deliver to the public. But also, lastly, we're encouraging most of health personnel to join in health communication, because we are part of it.
Thank you, Kuduisha. So I'll have the three questions before, as the RMO is preparing to give us a wrap up. So there's the one from the Rastaman there, my fellow Rastaman. You know, I'm also a Rastaman. If you have spiritual eyes, you will see that the dreads in my head, you know. You don't have spiritual eyes. So Rastaman, please, one question. And then there was a question from the lady here. Dr. Alafu Jirani. Yes, so from my fellow Rastaman, Mike Ejafikia.
Asante sana Rasta.
Thank you.
Yeah. Kwa majina naitwa Walter Mia, natokea taasisi ya Mwanangu Development Tanzania. Ni mwanaharakati wa afya ya mtoto. Nawapongeza sana kwa kazi kubwa, lakini nilitaka nimuulize mtu wa wizara, kuna mpango gani ambao mnaweza kuhusisha pia wadau mnapokuwa mnafanya kukutana na hawa CHW, kuwapa zile elimu au mafunzo? Kwa sababu mimi labda naweza nikasema ni CHW pia naenda sana huko chini, lakini kuna baadhi ya elimu hazifiki, hazipo kwa watu, na niongea ukweli, hazipo sio kwa community tu, hata kwa yule mtu wa huduma wa afya wa kile kituo cha afya pale haelewi. Na tunapoplan mambo yetu, kuna makundi hayaongelewi, na mimi naongelea kama makundi ya neurotube defects. Hatujui hata data, tunaongelea digital, lakini ndani ya wizara leo tukiuliza una data ipi ya watoto wa hydrocephalus au spina bifida, i-present, tutapigana chenga. Je, kuna mpango kazi wa kuwatumia hawa CHW pia kuingiza mfumo wanapoenda kule chini waweze pia kukusanya hizo taarifa, ili na nyie ndani ya wizara mzipate, na ndio maana muweze kufanyia kazi kwenye hayo maeneo? Sasa hivi ni magumu kuyafanyia kazi kwa sababu hatuna data. Hatuwezi kuomba hata msaada wa fundi, tunaeleza what the ukubwa wa tatizo ukoje. Je, sasa hivi mkiweza kuwatumia hawa kwenda kukusanya hiyo taarifa kule chini na ikafika huku juu, manaki kuadi kwenye ile poto au kwenye ile software ambayo mnayo, kuadi component za hili tatizo la neurotube defect, it's a big problem in a country. The second question, hapo kwa wizara, muongozo upi unatoa kama binti yangu alivyosema anatoa elimu ya uzazi shuleni? swala la spina bifida is a big problem. Tunatoaje elimu ya folic acid kwa vijana wetu kule mashuleni kwa ajili ya prevention ya spina bifida, endapo siku moja imetokea na wao kuelewa hawa ni wamama watarajiwa? Tunaingizaje kwenye digital hata hizo message zikawafikia na jamii wengine kwenye community, kwa sababu tatizo linampata mtu in 4 weeks.
Thank you. Dr. utatusaidia kujibu hilo swali kwa niaba ya wizara? Yes, please. Immediately kabla halijapotea.
Asante. Okay, yes. Dr. Felix, the Assistant Director responsible for the charge and thank you very much for the comments. Number one was, I think, for the comment of the data, and it wasn't like straight to what is being done at the top Ministry for Health of PO-RALG, but all of us to ask ourselves how can we collect that data for the different disabilities, including the spinal bifida, but plus others. I think that you have to see the way we can improve data collection through our routine health systems. Now we might be doing that, but maybe due to some of the reasons to improve further. On the issue of prevention, I think it's being done through different approaches, especially that deals with issue of nutrition. But we need also to be guided, and I think we have the use of folic acid in prevention of the neurotubal effect. I think they have much other science, not only just taking that. So I think let's take this one as the comments na tuone namna gani tunaweza kuimprove, kwani kuzungumza namna kufanya hizo data collection, lakini pia namna ambavyo tunaongeza elimu kwa different approaches ambazo zipo na intervention mbalimbali za lishe ambazo zipo, ili tuweze kufanya sio tu kusubiri, not only just waiting to manage, but to prevent.
Tamwalika Raimo aje atufanyie wrap up.
Thank you, Mr. Rastaman.
Thank you.
My name is God Raver. I work in the mental health. I'm in the field of psychology, so primarily mental health and coaching, but also engaging projects that evolve around community work. So a lot of things have been shared that I'm very passionate about, but I'm going to just go directly to the albino children because that really touched my heart. And I'm curious to know, as you mentioned in one of the cases where the child is literally being locked inside because of shame, is there any kind of structure, form, or way to help these albino children? Because growing up in that kind of environment is going to cause so many problems, both physically, mentally, emotionally, spiritually. So is there any plan on how to help these albino children in getting from, I don't know, in terms of like, are there any facilities, any form of care they can get, any form of educating the parents to reduce the stigma, to help them through their process in accepting that their child is albino, because there are many factors involved. Thank you very much.
Thank you so much. Swali zito hilo limeenda kwa CHW. Can you imagine? Alongelea yule mteja Liberatus, baada ya wewe kutoa ule mfano wa kwamba ulikutana na albino ambaye alishindwa, hakuletwa kwenye chanjo kwa sababu ya kufichwa. Sasa muuliza swali anauliza, je, kuna mfumo wa kuwezesha watu kama hawa waweze kupata access? Nadhani inarudi kwenye kama ile issue ya mwanzo ya inclusion, Dr. Nkungu, si ndio? How do we ensure that no one is left behind? Ndio maana halisi ya access, kuhakikisha kwamba watu wote wanakuwa na access. Kwa hiyo it's unfair kwamba unaweza ukajibu hili swali, labda tuirudishe kwa wizara kidogo, uiongelee for 1 minute and then I will invite, muda hauturuhusu. Nimeona maswali yapo ya mengi nimeona around. Please write those questions, tutaendelea kuzi-attend. So mbele, you respond for 1 minute and then Anita, can you wave? Kama una swali, unamuona yule dada pale nyuma, unampatia swali lako pale ili discussion iweze kuendelea. Nimeona swali la Dr. Ngasongwa, naamini lilikuwa zito sana, ila liandike alafu tutaliattend. Please.
Asante. Kama tunavyojua ni wajibu wa wizara kuongoza utekelezaji wa afua mbalimbali zinazohusiana na afya. Na kwenye afua zinazotekelezwa kwa kiasi kikubwa wizara inaposimamia miongozo yake kwenye maandalizi yake hakikisha inajumuisha eneo hili la disability. Limeanza hivi karibuni na nahakikisha kwenye miongozo yote ya kutoa huduma za afya eneo hili la disability litajumuishwa. Na kinachotakiwa sasa na jamii ni kuongeza kutoa elimu ili tuondokane na zile tamaduni zinazopelekea watoto kama hawa albino kufichwa na wale wenye mapungufu mengine kufichwa ndani ya nyumba kwa sababu ya zile tamaduni. Hii ni wajibu wa kila mtu kwenye kupeleka elimu kwenye jamii.
Thank you so much my panelists. A round of applause jamani kwa panelists wetu. Nimegusiwa hapa kwamba hizi barcode zinafanya kazi, so if you have a question just scan. Si ndio technologies jamani? I'm not too old jamani kushindwa hii. Kwa hiyo tu scan hapa alafu tuweke maswali yetu pale alafu tumalizie. So panelists, I thank you so much for your time. I know there will be some questions to you. Tutaendelea kuya-attend. For now ni mruhusu mganga mkuu wa mkoa wa Morogoro Dr. Best Magoma aje atufungie session yetu, concluding remarks, and then baada hapo tutapiga picha pamoja na nadhani muda wetu tutakuwa tumeufanyia fair ili tuende kwenye chai. Dr. Magoma, please, karibu sana.
Thank you, the moderator, my colleagues, the panelists, as have been introduced. Dr. Magoma, the regional medical officer for the current regional medical office. You have to stress that because it's not a permanent thing or permanent post. Up to this moment, I'm the regional medical officer. I'm very much delighted for my colleagues here who have been leading the discussion and giving the highlights, and also for the SolidaMed, as you have been working with them for a number of years in Morogoro region, now counting to 4 or 5 councils. And you are talking about the issue of expanding them to go to other regions, but we haven't yet finished our business in Morogoro. So let's finish first Morogoro region, and then maybe others can decide to send them somewhere else. I think there was a tendency of having a partner working just in one council in a region. That is not, you cannot even justify what they are doing. But at least now they are expanding to that area. I'm here on behalf of my colleagues. We have to appreciate whatever has been done, all kind of gains we have. We are here just as representatives. We have our colleagues right there, the DMOs and the others, and even the healthcare workers who have the great champion for whatever has been gained. So we are here just representing our colleagues for the good work which is done. And it's very important to acknowledge that, because for us who are the managers or leaders, there are times we take all the credits for ourselves, which is not good. We have to appreciate that others also are doing great. To wrap up this session, their call of action is very obvious for what we have been discussing. There are a number of community initiatives which are done at the community level, not only in Morogoro region, but in other places. what we have to do now and what we have to advocate more is the issue of integration to whatever exists at the, down there. We are doing a lot, and most of the IPs, when they come in our region, most of the thing we have been insisting is the sustainability, and it's very easy to have a sustainable to be sustainable if there are, whatever is done right from the beginning. The concept of integrating them in the existing system is there. There are issues of these preparedness clubs, issue of peer educators, the other issues are community health workers and the others, mobile services we're having there, specialized clinics and others. We need them to be integrated in the system, and that is a call to other places. Whatever is done, let us think about right from the beginning, even at the time of proposal writing, to see how we can integrate to the existing system. That's very important. And the second thing, the issue of community health workers. This is a cry all over the world now. I remember now you see, in the past you used to see the community health workers, they're old people with very heavy sunglasses. Now we have these young men. And this is a trend all over the world now. I remember 2 years back I went to the World Health Assembly in Geneva as part of the delegates of the ministry. There are neighboring countries. We have panel group discussion, and the community health workers from Kenya were there talking very loudly. So that's something they even go to Geneva now. So you have started coming Dar es Salaam, my friend, next time to Geneva. So that is a stage. Because we need these initiatives. In the past, we thought we healthcare workers, we can do each and everything. Now we have seen clearly that we need other supportive structures like this one, especially the issue of preventive health services and others. So we need healthcare, the committed workers, and we appreciate what the minister has done now. Now they are well aligned. They get proper trainings, and most of them are young men who can be there. In the past, you find in some places, the wife of the village chairperson will be the community health worker so that to get something. But now we have this young generation, I think will move very far away. They can access digital forum and others. They work differently in comparison in the past years. So there's a call. We know government is doing a lot, but even partners should also continue supporting not only technical issues, but also in financial support. We know the government can't do each and everything. So I think that is a call for partners, not only Solidabed, but others to continue supporting us in these initiatives, various initiatives. And also the other issues of this adolescent health initiative also should be supported, and you should see how we use them very effective. The issue of media, that's very important. Now we don't only talk about traditional media, we talk also about the one we have now, social media and others. And I think the most important thing is to use the kind of media which is congruent to what is there at the community. There's an era of media people, but suppose you are grandmother at the village. It's not possible to go to WhatsApp and other things. So we also need to use the community radios and others and other outlets which are there, which can be beneficial, so that we cannot leave anyone behind, can capture each and every segment of the society. For Morogoro region, how many minutes did you give me? You know, I can talk even for 2 hours. So let me wind up. Let me wind it up. For Morogoro region, we are there, and we are ready, and we do support each and any workable and sustainable initiative. That's why we work very closely, Solidabed, and not only Solidabed, but also other partners. We are there, we are free. You can come and work with us. Morogoro there are 2 regions which have been united. It's a very big region. The second region by size now after Tabora. And I was hearing that Tabora, they are planning to slice that region. So if that will work, now Morogoro will be the largest region. And we are planning to conquer other places. We can even take Njombe to be part of Morogoro. So we are planning. We are not planning to slice it, but also to take other part, to have other colonies. Yeah. So, being in that position, we need much support. There are a number of challenges, and I've experienced working different regions, different size, starting from Kilimanjaro, Dodoma, and now Morogoro. So I understand. But I love Morogoro the way it is. I want to add it if I were in that position. So we need other kind of initiatives, and what has been done is not enough, but we appreciate the great work which is done by the government with support also of the other partners who we are working with. So you are warmly welcome in Morogoro. Thank you very much.
Asante sana, asante sana. So nataka niwapatie zawadi surprise kwa watu wote ambao wameongea, ambao wameshiriki. So may I welcome facilitators wetu kwa ajili ya kuwapatia zawadi ma panelists na wengine wote ambao walishiriki. Kwa hiyo kama ulishiriki, karibu Dr. Best, karibu na timu yote, karibuni hapa mpate zawadi chapchapu ya kwenda kunywea chai. Ya kwanza inakwenda kwa Dr. Samuel Kikaro ambaye ndio mimi hapa, au sio? Asante sana. Makofi kwangu. Shukran. Nimeona nyingine imeandikwa Dr. Gerard Kiwele, so you represented him. Kwa hiyo utamrepresent pia kwenye zawadi ya kikombe. Inaenda pale katikati kwa Dr. Kiwele. Mpatie zawadi Dr. Kiwele, mfikishie salamu. The other one goes to Dr. Walter Milanzi from UDOM. Atanywea chai kule UDOM. That's very good. And then Elizabeth, our own CHW. Okay. Then we have Dr. Kuduishe, kikombe cha media. Hongera sana. And then we have the President of Medical Association of Tanzania, Matt, Dr. Mugisha Nkoronko. Please, kingine kinaenda kwa Arafmin Petro, out of school, makofi kwa Arafmin. Then we have the other one to, picha, Arafmin anataka picha. Yeah, muhimu sana. Anita atapata. Kingine kinaenda kwa Dr. Daniel Nkungu. Yes. And then Liberatus Emmanuel, na zawadi ya mwisho inaenda kwa nani? Ya Anita. So last, naomba wote tu kae pale kwenye bango. We have the one which is very important from THS. Kwa hiyo tunawakaribisha THS kwa ajili ya picha. Yes. The last one goes to from THS. THS, karibu THS. THS, please, the floor is yours now. Okay. All right.